We use MEG for planning of epilepsy surgery and invasive recordings in patients with pharmacoresistant focal epilepsies. So especially the very complex cases, I think, benefit a lot from MEG because we are actually able to nicely image the epileptic activity. MEG has the advantage that it's not sensitive to changes of the anatomy. So if you have a patient that actually has a large lesion or previous surgery or just very complex structural alterations, complex anatomy, then MEG will still give you a very, very nice undistorted view on the cortical brain activity. We usually also combine it with simultaneous EEG, which actually gives us a very nice comprehensive picture of the brain activity that's going on. Studies show that MEG provides additional information in about 1/3 of those complex cases, where it really changes the therapeutic or diagnostic approach. So, for example, MEG can actually influence how many electrodes are implanted for invasive EEG, what the coverage is. It makes sure that you also cover areas that show epileptic activity. MEG actually helps us to resect the area that then generates the seizures. And if you resect it, you actually have seizure freedom for the patient also in the long term. What MEG is able to do for these patients and how it can improve their situation and the epilepsy that they've been suffering from for some decades in some cases.
There is a myth that if your EEG is normal, you would not benefit from MEG scan. But actually, if you look at the literature, almost 30% of those patients may have a really good positive finding on the MEG scan, which can point you in a really good direction. And MEG scan can be really helpful because of its accuracy in spatiotemporal resolution, that it can accurately point to an area where the seizure are starting from. So the MEG scan can really pinpoint to the seizure focus coming from the insula rather than the temporal lobe. That MEG scan should be a standard of care for patients who are undergoing a pre-surgical evaluation. I would like to tell to my colleagues, the neurologists, the epileptologists, you don't need to wait for that many years to start using the MEG scan. There is wealth of information now.